So, ladies and gentlemen, my name is Sharon Whiteman. I'm part of the executive team at the Lyme Disease Association of Australia. And we're so privileged to have Dr. Nancy OHara give us some of her late evening time in the US to help Lyme and associated diseases patients here in Australia. So we haven't had very much focus on pediatric Lyme and the presentation and the solutions up to date with any of our interviews. So I'm really excited to be able to offer this because we have a lot of kids coming into our inbox. So Dr. Nancy OHara is a board certified pediatrician who specializes in treating PANS, pandas, basal ganglia encephalitis, and other neurodevelopmental disorders. She is a leading trainer and mentor of clinicians in the US and globally, educating medical professionals to recognize, diagnose, and treat PANS, pandas, and BGE. Dr. OHara graduated with highest honors from Bryn Mawr College as part of the Alpha Omega Alpha Honor Society from the University of Pennsylvania School of Medicine. She earned her master's degree in public health from the University of Pittsburgh and completed her residency, chief residency, and general pediatric fellowship at the University of Pittsburgh. Before she began her medical career, Dr. OHara taught children with autism. From 1993 to 98, Dr. OHara was practicing general pediatrician and partner in a group practice. In 1999, she began her consultative integrative practice for children with special needs, dedicating her practice to treating children with neurodevelopmental disorders, ADHD, PANS, PANDAS, BGE, OCD, Lyme, and autism spectrum disorder. I get goosebumps reading that, Dr. OHara. I was nervous this morning. I've done lots of interviews and I was feeling really nervous, but I'm so grateful. Thank you for being here.
I'm so glad to be here. And for me, the best form of being a doctor is two things: one, teaching, and the other, listening. And I've learned more from parents and groups than I have worked with than any book or any other doctor for that matter. So happy to be here.
And we had a brief chat, and you've been to Australia several times. What brought you here?
I have been there to lecture with the Mind Institute, as well as BioBalance. And I think I've been there a total of 9 times. Would love to come back anytime, and really have enjoyed all of my trips. Been to as many places in Australia and New Zealand as I can get to. But I was sharing with you a quick story. When I first came, this was probably over a dozen years ago now. The doctors there were arguing that Lyme disease was not in Australia. And, there were a few enlightened doctors that were saying it's definitely here. And there were others, wonderful doctors, that were saying, no way, there's no Lyme disease. I said, you have Lyme. And the last patient of the day, after a week long being there, walks in and he's complaining of heel pain. And he said, yeah, I bunch up my socks and the bottom of my shoes. And I said, Bartonella. And she said, nah, that's just sensory. And I'm like, Bartonella. And so we get to talking to him, and he's talking about other symptoms and talking about rage he gets and other things. And I said, do you have any rash? And he goes, well, I've got these stretch marks. And I said to her, you got Lyme, it's Bartonella. And thankfully, he got treated, he got better, and it actually helped many of those doctors to see that it actually is in Australia, as it is in all parts of the world.
Absolutely. And, sadly, it's got worse since then. So
Yes.
Recently, doctors have been mandated away from even GPs can't diagnose or treat or test. And you have to refer to an infectious disease specialist. So pediatricians wouldn't be allowed either, at risk of their careers. So it's pretty dire here. But this education really does help people because they can take their power into their own hands. And so we're very grateful. So how, it's obvious your career, you're interested in children through teaching and then into becoming a pediatrician. How did you become interested in Lyme in kids?
I was first a teacher of children with autism and then had my consultative integrative practice. I started it after going through many years of infertility. And then after meeting my mentor, who's Dr. Sidney Baker, it changed my life. I learned about functional medicine and all of the different iterations of that and got pregnant. And when my son was 9 years old, he was neurotypical and got bit by a Lyme positive tick. The same week he got strep throat and a viral infection and devolved into seizure-like tics, movement disorder. And thankfully, because of what I knew, I was able to treat him for 3 months and he got better. But I missed Bartonella.
Yeah.
And 7 years later, he took his shirt off, and it had now been a couple of years since I'd even seen his back, now that he was a teenager. And I said, Jake, what's that? And he goes, what? I said, that rash on your back. And he had the classic stretch marks. I mean, you'll see him in my book, you'll see him in some of my lectures. He had Bartonella. What was very interesting to me is, even though he got better 7 years earlier, he had still had what we call a 504, some accommodations for processing speed and difficulties with learning, and still had some anxiety and OCD. And when we started treating the Bartonella, all of that got worse at first, the classic Herxheimer, but then all of it went away when we finally treated Bartonella. And it reminds me every day to push a little bit harder to find it and treat it in all of our kids. So that's how I got started in it, and then joined ILADS, which is the International Lyme and Associated Disease Society, and took courses and gave trainings, and now it's and I live in Lyme Central. I mean, Lyme disease came from Lyme, Connecticut. I only live a few minutes from there, so it's ubiquitous here.
Yeah, and so fortunate, really, in a weird way, that he had a tick bite that was known, because so many people don't have, at least over half of people don't remember a tick bite and still are Lyme. And for the definition today, there's a lot of debate in Australia. We'll include Lyme as an umbrella term for multiple infections, if that's okay, because there's a lot of debate in Australia around that. So for Lyme kids, like known tick bite or not, is there a pattern of presentation? Is there a common way they end up coming to you?
So most of my practice is neuropsychiatric or neurodevelopmental. So most of the children that come with an abrupt onset of anxiety or phobias or OCD or panic attacks, etc. And that is a classic way that children can present. The terrible triad, as we call it, of Lyme disease in children is non-restorative sleep, cognitive impairments, and fatigue. So that's the triad. But what we see in our own practice is those neuropsych symptoms. We also will see hypersensitivity to light, to sound, slow processing, executive function, memory issues, processing issues in ADHD, the brain fog. Besides the anxiety and the phobias, there's also a real low frustration tolerance, irritability, and anger. And then, as we see in adults, many neurologic symptoms, musculoskeletal aches and pains, headaches, etc., especially those that are migratory in nature. So all of that, but you can definitely have Lyme without any joint or musculoskeletal symptoms.
Okay. And is there anything in particular, like, do they tend to flare up at teenagehood or at puberty, or is there any kind of patterns for when it surfaces if they've been pretty okay?
We can see it at almost any time, because my career started with autism. I used to say that Lyme disease and autism were overlapping circles of the Venn diagram like this. I now think it's more like this. And many of our children present with gestational Lyme, moms that have had tick-borne disease, and children very early on will have problems. Certainly, the more indolent presentations can come in adolescence. But the younger the child, the more severe the impact will be on the developing nervous system. So it really depends on the symptoms that you're talking about. These kind of phobias and neuropsychiatric, we certainly see that later, sometime between 8 and 15. I am a pediatrician, so I don't like taking care of adults at all. And that includes once they get above 16 and all, they start to be, so our bent in our practice is certainly in the 2 to 15-year-olds, but the classic presentation is often that 8 to 15.
Okay. And like I was mentioning briefly, I have 2 kids or 3 kids that are at risk and 2 that I see symptoms in. And one is very, scattered thinking, but they're both high functioning, like A students really. But it's stressful for them in organization. And the other one is sort of chronic fatigue and achy all the
Yeah.
time. So and it is for people listening today, mums, parents, aunties, uncles, etc., of a loved child. It's really hard in Australia. So um, is there any other ways that kids can be affected outside the typical Lyme kind of symptoms? Is there other ways they're impacted by Lyme that you see?
The behavioral changes, the cognitive deficits, the intellectual functioning, the sleep problems. And then, of course, there can be rashes with Lyme disease. The erythema migrans, the typical bullseye rash, is actually only seen in 20%. So it's not that common to see it in children. The stretch marks of Bartonella can be anywhere on the body, and they don't follow dermal lines. What that means is when you have stretch marks because of weight gain or stress, they'll follow the lines of the skin. Whereas with Bartonella, they'll be horizontal or vertical. And they will blanch. Stretch marks that are due to weight gain or weight changes or stress do not blanch. So those are really typical findings to look for. We also see, as I was mentioning of that young man, the heel pain, the bunching up of the socks, the sensory things. They may, like our mold kids, they may have ice pick sensations. Their skin is on fire or feel prickly. They may feel like bugs are crawling out. Those kind of sensitive things are not uncommon in kids. And the presentation can wax and wane. It can be more prevalent around the moon cycles. And that's because Lyme, when it's more chronic, will bury in deep tissue as well as parasites. And parasites proliferate with the moons. So when things get worse around the moon cycles, think not just about parasites, but think about Lyme. The onset can be abrupt or indolent. Abrupt, it's more in that PANS, that pediatric abrupt onset neuropsychiatric syndromes. When it's more indolent, it's much more the fatigue and the cognitive impairments.
Okay. And what's your recommendation, strategies, protocols for diagnosis? Do you require a positive blood test, or how do you diagnose these kids?
Even the CDC, which is our Centers for Disease Control, admits that Lyme is a clinical diagnosis. I give lectures on Lyme all the time, and I was just preparing one and copied the actual quote from the CDC. If your child has symptoms, you do not need a positive test. So first of all, in the acute situation where you actually find a tick bite, and I agree with you, it's rare. I much prefer when I find it and can test it or know that it's there. I just assume they're there all the time. But anyway, if it's acute tick bite, you may not see a positive test for 6 to 8 weeks, and you don't want to wait to treat. If it's more chronic, as I said, what Lyme wants to do, our bodies don't want to be sick with it. What Lyme does is it buries deep within tissues or within cells, so it makes it very hard to treat and very hard to find. So a negative test doesn't rule it out. When you do a regular lab test and it's positive, that's definitely positive. But when it's negative, it doesn't rule out the disease. So I think the most important thing for parents, especially when it's so hard, and it's very hard in this country, I cannot imagine how hard it is for you there. But when it's hard to treat, work with a professional, a health coach, a naturopath, a nutritionist, a dietitian, any practitioner who would help you. in treating your child naturally, functionally, naturopathically with botanicals and herbs, which, by the way, the research is coming out that herbs may be even better than antibiotics in treating Lyme.
Oh, wow. That's good.
So.
And so do you have so for symptoms, say parents struggling on their own? I was talking to a mom the other day who had a PANS presentation for her child and was nonverbal, and she was really distressed. I was in the car, spent an hour with her when I was waiting for my kids at tutoring, and she was really on her own and really asking for help. And I told her that I'd be sending this. So like, if you've got parents in a situation like that, is there any particular signs or symptoms that would indicate a herbal route that they could do safely on their own?
So I do differentiate between particularly the 3 Bs, Lyme, which is Borrelia burgdorferi, and dozens of other species of Borrelia, Bartonella, which can come from cat scratches, cat saliva, cat bites, as well as ticks, fleas, mosquitoes, lice, and Babesia. So when I'm thinking about Borrelia, Lyme disease, I'm thinking about joint aches, musculoskeletal problems, and the terrible triad, that fatigue, non-restorative sleep, and cognitive impairments. If a child has that, I would consider herbal interventions. And one of my favorites is Japanese knotweed, which is a wonderful herb that naturally contains resveratrol. And herbs can be given to children via what's called Clark's rule, which is taking the child's weight in pounds, not kilos, but in pounds, and then dividing by 150, and then taking that number and multiplying by 30. So, for example, a 75-pound child, which would be like a 30-kilo child, 35-kilo child, would have, her dose would be 15 drops per day. Now, whenever I treat anything herbally or in any way functionally, nutraceutically, anything, I always start slow. So, for example, with 1 drop, and build up slowly. So start low, build up slowly. And in that way, you may avoid Herxheimer's or die-off reactions, and you may see more improvement without any negatives. So with Bartonella, that heel pain or bunching up the socks, sore soles of the feet, the daily flare, the daily rage and anxiety, the blanching stretch marks, those are classic for Bartonella. And Japanese knotweed is also one of my favorites there, as is Cryptolepis. And Cryptolepis was the herb that was found to be better than doxycycline and cephalosporins in treating Lyme disease, both Borrelia, Bartonella, and Babesia. And then with Babesia, what I look for is night sweats, an unrelenting headache, especially one that seems like a band, and air hunger, that kind of panic where they feel like they can't get a breath. Those are classic Babesia symptoms. Now, there are a lot more in all of those categories, but when I'm starting to treat a child, I think about a multi-system approach, because it's not just about the germ. That's where people go wrong. It's about how that spirochete, how that Lyme germ attacks the system. So you also have to treat the immune system. So anti-inflammatories, mushrooms like cordyceps, lion's mane, like for kids that have brain fog, as well as anxiety, curcumin, which is a lovely anti-inflammatory, the resveratrol and Japanese knotweed. So I also am supporting their immune system, and then also treating the symptom. For example, if the child has a lot of anxiety, I may be giving them more magnesium, or ashwagandha, which is an herb if appropriate, or Zen, which is a supplement with GABA in it. So, and also making sure that I'm supporting that child in every way, which includes for us moms in breathing. As somebody who's been through this many times with my own son, as well as many families, putting on the oxygen mask first is really important to do.
Mhm.
And if you're, as a mom or dad, no offense, dads, so stressed out by even the thought of everything I'm saying, first take a breath.
Mhm.
First say, I can do this, and take one step. So anyway, and I work with a wonderful dietitian who can help a lot of moms remotely. I cannot. I have to have somebody come to Connecticut, but she can help people via telehealth who otherwise might not be able to find somebody to help them. So I know you have a lot of wonderful people in Australia, but I just wanted to put that out there. If somebody is searching, we also have somebody who's very well trained in Lyme.
Awesome. That's wonderful, because it is its own specialty, isn't it? And
Yes,
people don't get it till they get it, really. It's just a
right,
good saying.
right.
And so these kids, can they fully recover?
Yes, absolutely. Absolutely. My son is now getting his PhD, just passed his candidacy in chemistry. It just happened this week. I just got back this morning from that. But it is a marathon. And that's the other thing that I think parents don't appreciate as much. They say, he's not better. It's been 3 weeks, or it's been a month, or whatever. We now say 9 months minimum. And it may take 2 years. And the older the child is, the longer it may take. And it is a multi-system approach. So don't lose hope, but also don't give up too soon. Keep going. And I think that was my biggest message when my son was 9. I probably gave up too soon, and I left his immune system unprotected from the things that were probably still there. So,
Yeah, there's a
but
lot
they
of knowledge
can
in.
recover.
Yeah, that's good. And what are the best strategies for parents to support their kids and their families during this time? Because it impacts the whole family, doesn't it?
Absolutely. Well, I think first of all, everybody needs to sleep. So whatever you need to do to help your child sleep, melatonin, valerian, lots of great products out there, sleep hygiene, cold, dark room, no screen time, no electronics, all of that kind of stuff, and everybody sleeping. That has to be paramount. The second thing is, the gut is not the second brain, it's the first brain. And the more you can support the gut, the better. So kids need to be pooping every day. And if you have a constipated child and you put these herbs in that I was talking about, you're going to get bad die-off or Herx reactions. You need to treat the constipation, aloe, magnesium, good fluids, good fiber. And it does start with diet. And although that is hard for some of our families, you do it much better in Australia than many of our families do in Connecticut, not to generalize too much, but my diet is always wonderful when I'm there. But anyway, just starting with one thing. If your child's eating a lot of sugar, trying to decrease that, sweeten with honey or xylitol rather than artificial sugars, especially. Decreasing carbs, or making sure they have a protein anytime they have a carb, and certainly trying to increase the good fruits and vegetables as much as possible. The best diet is an anti-inflammatory diet. So increasing good proteins, good oils, good fruits and veggies as much as possible. And just those simple things will go a long way to helping our kids feel better. And then beyond that, it's the 3-pronged approach. It's adding one anti-inflammatory, adding the antimicrobials that you can, and herbally is fine, and adding something else for the symptoms, whether it be anxiety, OCD, tics, brain fog, whatever it is. And in my book, it's about PANS and PANDAS. There's a whole chapter on Lyme, but all of the things that I'm talking about, there's a chapter on each of the symptoms, and it's all about functional medicine. So all of these are things that parents can do, with their child.
Awesome. And what about the mental health aspect of things in families?
Yeah. Again, the more we breathe, the better. If a family can go for walks together, with good tick protection, um, do yoga together, mantras, even the littlest kid can sing Let It Go from Frozen, and that can be a mantra. It doesn't kids can meditate, just observing their breath can be a form of meditation. That is really important. I am a big believer in therapy. And if a child can't do it, some of my favorite is cognitive behavioral therapy, and parents learning how not to feed the beast of this disease. So much of the time when kids are sick, we want to, for lack of a better word, coddle them. We want to, you don't feel well, you don't have to do your chores. No, the chores still need to be done. The homework still needs to be done. The support can be given. And that's an important factor because this is such a prolonged illness in so many children. And then trying to be on the same page as parents. As moms, we tend to want everything just so, at least this mom. And I think sometimes we can give a little so that we're in sync with our partner. Because when things are conflicted between the parents, the kid feels the brunt of it. And so maybe, not having that perfect meal or not having that perfect bedtime routine may help dad to be more on board. And again, not trying to generalize, but trying to help families be more cohesive. And then finding somebody who listens, like your group, like you in the car with that mom, but finding a practitioner that does listen. That, I always say the best instrument we have in our practice is a tissue box. It's not about anything else. It's really about listening, because we then learn what are the most important things for that individual child to help them. So.
No, that's awesome. I was thinking, and what about treatment failure? Like sometimes when I've spoken to doctors, they say if you don't address the viral load, that can sometimes cause treatment failure. What do you see in your practice?
Yeah, I think, again, multi-system. I think that we find a lot of children also dealing with mold or yeast. Children that have been on antibiotics forever come in very yeasty, or that have lived in water damaged buildings have mold. Those need to be addressed. Some of the children, chronic infections can cause mitochondrial dysfunction. The mitochondria are the energy cells of our body. They're what make our engines run. And so if the mitochondria are not supported, the kids won't get better. As you mentioned, chronic viral load, viruses are ubiquitous. And oftentimes we're not treating all those different infections. It's not that we have to put on yet another antiviral or antimicrobial. Some of the best antivirals are natural. It's vitamin A, vitamin D, vitamin C. It's lysine, which is a wonderful amino acid. Monolaurin, particularly forms with a biofilm buster, can be really helpful in treating multiple different germs. And that's why I like herbs too. Antibiotics may just treat that Lyme germ, but the herbs will treat the yeast and the virus and the Lyme and the co-infections and multiple different things at once. But it is, and I have lots of slides in many of my lectures on my website, because it really is important, whether you're looking at all the spokes in a wheel or all the petals on a flower or all the parts of the pyramid, whatever thing you have in your mind. Don't just think about treating Lyme. Think about Lyme as a multi-system disease. And treating the gut and the immune system and the mitochondrial and metabolic systems. And I know that all sounds overwhelming, but it really isn't. You can use 1 to 2 things for each of that, and you only end up with 5 or 6 total that a child may be taking.
Okay. And do you want to touch on what to do to help the gut and what to do to help the mitochondria?
Yeah, sure. So the mitochondria, first it's getting at what's the root of the mitochondrial dysfunction. Is it Lyme disease? So treat the Lyme. But the mitochondria themselves it's called a respiratory transport chain, and it's along the membrane of every cell of our body. And it's what lets things into the cell, like carnitine and things like that. So there are very good mitochondrial supports that either have carnitine or, one of my favorites, CoQ10. Essential fatty acids, those good oils that I was talking about, those are really important for the mitochondria. The omega-3s, the olive oil, coconut oil, avocado oil, macadamia nut oil, if they're not allergic to nuts. Those are all important for the mitochondria. And then there are blood work, regular lab tests, a carnitine, an acylcarnitine, a creatinine kinase, ammonia, lactate that you can get from a regular lab. And I've had many children in Australia have these done through their regular physicians. And if there are specific abnormalities, treating that. Is that abnormality. For instance, if the carnitine is low, adding carnitine can be very helpful. And mitochondrial dysfunction can look like a super revved kid, like they're abnormally hyperactive or stimulated, or a very lethargic, fatigued, low stamina kid. And your treatment will be different depending on which one it is.
Okay.
As far as the gut goes, it starts with diet. I have been known as the diet doctor, and people have said, I didn't come to you because I wasn't ready to do the diet. Just do one thing. If your child is eating only dairy, try to take the dairy out, put in dairy alternatives. I mentioned about sugar and carbs. If they're not eating any protein, try to get more protein in, even if it's protein powders. And then treating the gut starts with treating constipation, as I said, developing a routine, giving more fiber or aloe or magnesium and getting that done. And then looking at, are there other symptoms of overgrowth of germs? For instance, Clostridia or parasites could be teeth grinding or butt grinding or abnormal behaviors, as I mentioned, around the moon cycles. Yeast overgrowth can look like anything a drunk would look like. So you can have a belligerent, agitated drunk. You can have a brain fog drunk. You can have a silly, inappropriate laughter drunk. Mm-hmm. Those can all be signs of yeast. And if that's the case, then you want to treat that. Treating it, again, is like treating an enemy army. You want to starve them out. So you don't want to feed junk food. There is no such thing as junk food, as my friend in Frank Golick in Australia always said. He had this picture of, this is just junk. It's not junk food, it's junk. There's food and there's junk. So anyway, if you're feeding the gut junk, then you're going to be feeding those germs. So it starts with diet, antimicrobials, and then support of the immune system in the gut. That may be probiotics, Saccharomyces boulardii, which is a natural yeast against yeast and other germs. It may be immunoglobulins to replace low immunoglobulins within the gut. So it's really, again, looking at getting rid of any abnormal germs, supporting the immune system of the gut, because that's where the immune system really starts, and doing all that with diet and appropriate supplements as you can.
Awesome. Is there anything that we haven't touched on that you'd recommend for families?
Take one step. Remember, you may take one step forward and take 2 steps back. For me, don't forget about the psychiatric pieces. 1/3 of psychiatric patients test positive for Lyme based on CDC criteria. In a Denmark study, 80% of patients with either anxiety, depression, bipolar, schizophrenia, or severe panic or phobias, 80% of those people had tick-borne disease in their past.
Wow.
And so when you think about psychiatric or neuropsychiatric problems, think about Lyme disease and find a qualified practitioner to help you. It doesn't have to be a doctor, doesn't have to be antibiotics. There are a lot of other ways to do that. But think about Lyme with an acquired case of ADHD, regressive autism, panic attacks that last a long period of time, bipolar disease in a little child, cognitive impairments that are also associated with anxiety, a progressively declining mental status, and even psych symptoms with no musculoskeletal symptoms. Think about tick-borne disease.
And what would you say to Australian doctors, with their pediatricians, psychiatrists, psychologists, teachers? What's your message to them?
Be open, listen. You can learn more from parents than you can from any book. We don't have all the answers. The first slide in almost all my talks are follow those who seek the truth, flee from those who have found it. So as a doctor, we don't have all the answers. And when we pretend that we do, that's when we make mistakes. We need to listen and be open and know that helping a child feel better may take lots of different modalities. It takes a village. We don't have all the answers, but if we listen to the parents in our practice, we can help these kids get better.
Well, I just thought of something I didn't ask you. What about when kids, how do you help parents when kids are non-compliant or resisting treatment?
Several different things. So if they're resisting treatment like therapy, one, I say the parent should go and learn the techniques. You know, one of the best things I learned from a therapist was for my teenage son to start with, I get it, even when I didn't, because when kids feel heard, then they're more willing to share thoughts with you. Remember that a lot of kids have looping thoughts in OCD that presents itself as anxiety, and they're so scared about the thoughts in their head, they can't even express them to you. So pretending like you get it, even when you don't, is really important. So that is one inroad, and learning that from a therapist yourself can be helpful. The second thing is they won't take stuff. Well, there are two schools of thought. One is hiding it. And, you know, a lot of these herbs are liquid. They don't taste great. It's very hard to hide. I certainly wouldn't hide it in a food that is a preferred food, because you're going to ruin that food. If you do hide it in something, make it like a shot glass. And I wouldn't hide it. I would say, this is something you got to do, and then give them a reward afterwards. You know, there's a great form of curcumin from Designs for Health that I think you can get in Australia, called curcumin of Vale, and they're like starbursts, and it's just curcumin. So, you know, and they taste good, you know, so you could give them the shot glass and give them a couple of the starburst, you know, the curcumin ones, and it's a win-win. But putting everything in a little shot glass, or saying, we're going to do this. And remember, you are the parent in the room, and don't make it 10 times a day. Pick 3 or 4 things that you can put in one shot glass, and that's it. And then, you know, maybe it's 5 stars in a week and you get a favored outing or toy, or I don't like food rewards, so to speak, but things to do with mom or dad. I find those to be really helpful. And then I think the other thing is looking at flavors. You know, you're never going to get liposomal glutathione in a kid. I'm sorry. It just tastes terrible. You know, but you could get NAC in a capsule opened up and put into something, and that's almost as good, you know. So finding the supplements that also don't taste horrible is important. And if you're working with a practitioner, ask them if they've ever tasted it. Because if they haven't tasted what they're recommending, then ask them to taste it first. because I'm the best taster because I am so bad at taking things. I choked on a vitamin C pill, so I can't even take pills. I literally put everything in a smoothie, and that's a good way. If kids will eat smoothies, that's another good way to get it in. And you can get a lot of good protein and fiber and veggies and all kinds of stuff in a smoothie, plus the supplements that you may need. But I open all my capsules up and put them in there, so I can tell you, what I can hide and what I can't from me. So
That's a
anyway.
good strategy. And what would you like to leave families with today if they're facing tick-borne diseases in their children?
There is hope. Don't give up. Don't think it's a sprint. It is still a marathon, but find people like yourself that will listen, that will help you find appropriate treatment and know that it is out there. And if you would like to talk to somebody in our practice, my website is drohara.com and all the information is there.
Okay, and because they can get your book there as well, and
Yeah.
the video. So we'll make sure that we put that with when we upload this video. So God bless you. Thank you so very much.
Thank
I know
you.
that's going to make a difference for families in Australia, and it's been a gap in our knowledge base. So I'm very appreciative. And I think you're filling Dr. Jones's big shoes.
Well, we're trying. They are very, very big shoes. And the one thing that I think families who worked with Dr. Jones didn't appreciate was the power of herbals. And I think today he if he were still alive, he would say, yeah, we should do more of that.
Yeah.
But he was such a stalwart and a remarkable light for so many of our families.
Yeah.
It takes a village of us to replace him. So we're trying.
God bless you. I'm so grateful. Thank you very much.
No problem. Great to talk to you. Thank you.